Hello everyone, I'm Dr. Karan Uddesh. I am a consultant physician in Yashoda Hospitals, Secunderabad. Today we are here to talk about sepsis and what are the most frequently asked questions about sepsis. So let's get started. So the first question is, what is sepsis? Sepsis is a life-threatening organ dysfunction syndrome caused due to an infection that is causing immune dysregulation. To put it in simple terms, a patient who has an infection, his immunity goes into an overdrive and causes organ dysfunction. This is sepsis simplified. Next question. How do infections cause sepsis? Any infection can cause sepsis. For example, a bacteria, a virus, or a fungus. Once they invade the body, the immune system gets activated and starts to clear them. But sometimes the immune system goes into an overdrive. Instead of just clearing the bacteria, virus, or fungi, it releases a multitude of chemicals into the blood vessels, causing inflammation and leaky blood vessels, which thereby decreases the supply of vital nutrients and oxygen to the organs. This causes organ dysfunction and sepsis. Next question. Who is at risk for sepsis? Anyone is at risk for sepsis, but more often than not, newborn babies, older adults, patients who are diabetic, who have chronic kidney disease, who have chronic liver disease, who are on chemotherapy, or who are on immunosuppressant drugs or steroids for autoimmune diseases. These patients are at a higher risk for developing sepsis in patients who have just a simple infection. How is sepsis diagnosed? Sepsis is more often a clinical diagnosis wherein we look for the focus of the infection, where the infection is in a patient who has fever. There are other things like a procalcitonin and blood cultures which determine the severity and the organism responsible for sepsis. How is sepsis treated? Patients who are diagnosed to have sepsis are treated with intravenous antibiotics and intravenous fluids. The choice of the antibiotic depends on the clinical spectrum of the patient and the site of the infection. Mainly, prompt and early treatment of sepsis ensures that the patient's mortality rate decreases. Next question. Can sepsis cause organ failure? Yes, sepsis can cause organ failure. Any of the organs of the body can be affected. It could be the brain, it could be the lungs, it could be the liver, it could be the kidney. Any of the organs can be affected because of sepsis. What are the early signs of sepsis? There are many early signs of sepsis. Any patient who has an infection and who is having a fever or is feeling extremely cold, is having decreased urine output, is feeling confused or disoriented, patient who has cold, clammy skin and is feeling extremely weak and who has low blood pressure and who has a high heart rate and is having difficulty in breathing. Any of these can be an early warning signs of sepsis, and if anyone has these along with an infection, they must consult a doctor as early as possible. Moving on to the next question. How can sepsis be prevented? Mainly it's the prevention of infection, so taking vaccinations at the right time, taking good wound care in patients who have diabetes and who are on immunosuppressants are one of the few tips that we can prevent sepsis. But early recognition and starting therapy early is the mainstays of treatment or prevention of sepsis. The next and the last question is, what is recovery like? Generally, patients with sepsis and multi-organ dysfunction who are admitted in the ICUs and are discharged later on are actually sick for at least another 2 to 3 weeks. That is, they feel extreme lethargy, they can have brain fog, and some people can even develop anxiety and depression. So a good nutritional support and seeking a psychologist therapy is absolutely important to ensure better and faster recovery. But more often than not, within 3 to 4 weeks time, patients do recover and they start to feel well post sepsis. Thank you.
Like, comment, and subscribe for more health updates.